Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, and today we have with us another special guest. This is Eric Knotts. Now, what makes him unique is he was actually someone that wanted to get into the pharmaceutical sales industry, and he found our podcast, which led him to what we do here at Evolve Your Success. He took one of our programs, he got into the position of his dreams, and then came back again to take our sales training, and now he's truly living his best life. Last week, we had Brett with us, and Brett was a medical device sales rep that wanted to get into a better position, and he found the program. Eric was someone that was outside of the industry. He was in sales, but he was outside of the industry. He wanted to get into pharmaceutical sales specifically, and he was able to make that happen through our program. So I want to have him on and just tell his story, because it's so nice to see someone that started, and this was back in 2021. So this is at the very top, January 2021. That's when he started. He got the position. He found us. He got the position in January 2021, and now, a year and 3 or 4 months later, he's living a completely different life, and he's still working with us in our sales training program. So it's a beautiful thing to see. His evolution has been amazing to see, and it's something that I believe should be shared so people can hear what's being experienced out there, and they can get their own insights on what this industry means from a couple different perspectives. So I am not going to spoil it. I will say no more. As always, thank you for listening to the Medical Sales Podcast, and I really do hope you enjoy this interview. Hey, Eric, how are we doing today?
Good. How are you doing, Samuel?
No complaints. I'm glad to have you on the show today because you actually went through our programs. You went through some of our programs with Evolve Your Success. You and I, we've literally become friends through all the work we've done together, and I thought it's good that people get to hear your experience, what it's led to, where you are today. So with no more of me spoiling it, why don't you tell everybody who you are and what you do?
So my name is Eric Knotts. Currently, I am a pharmaceutical sales rep in the mental health space. So for CNS, I work with the antipsychotics. Won't get into too much details, but it's a very rewarding career. And I got to where I want to be, partly in part because of you, because I was kind of hitting a dead end in the interview process. I was getting to the point where I would get an interview and not even hear anything back, and then I would get to the second and third round of interviews, and then again, not not hearing anything back. And my resume was great, but I knew there was something missing, and so I literally read every book I could find. I listened to every podcast I could find, which was only one at the time. I think now there's a few more, but yours was the only one at the time. So, sure. And I think when I was listening to it, I could just tell that you knew what you were talking about. And a lot of the points you were making, it really hit home. And for me, I knew that one of my weaknesses was confidence and really having that ability to get through the interview itself. Because I was selling myself on paper if I was getting those interviews, but there was something lacking in the actual interview itself. So, and I remember giving you the call, went to a restaurant, celebrated that night. It was awesome, but it feels like so long ago now.
I know, that's...
Yeah.
It's funny because, when was that? How long ago was that?
That was 2021. So last year, it would have been January.
January of last year. Wow.
Yeah. Beginning of January, I think.
Yeah. I mean, and now as a pharmaceutical sales professional, I mean, you feel like you've been locked in for a minute, right? It doesn't feel new at all.
No, no, and you know what? The weird thing is that that same thing that I was working on in the interview, it's butt up in different places because now that I got comfortable with the interview process, now it's like I'm getting comfortable with the actual job itself. You've seen me evolve.
Right.
Um, but that's what I really like about the program is you're really able to pinpoint kind of the areas where you really need the work done,
Yeah.
and that's what the value of both of your programs provide. I know it's quite a bit different than when I took the program, but I would highly recommend the at least the program to get you the job. And Samuel and his team are awesome. They'll be able to guide you through and not only get you the job, but get you to excel after getting the job. So um, we still got work to do, though. I will tell you that much.
That's why I like you being on the show today because you got to experience the program in its earlier stages. Now it's so much more built out, and we have such a larger team, and so many people are working with us to ensure that everybody that comes to our table gets success. But what I love is that you use our program to get into the position, and then you're still with us with our sales training, and like you said, you've been experiencing uh, a rapid fire understanding of how to perform at your highest level in this position, and you're doing it. Talk to us a little bit about what the experience has been like. I mean, you had a perception when we were working on your interview, and you had a perception of what the industry would be like. Now you're in it. Now we're working together. What's it like? Talk to us a little bit about it.
I guess it's kind of like a two-part question. My perception of the industry, first of all, has definitely been changed. Just I think it was a really interesting time to join the pharmaceutical sales industry for multiple reasons. Everything's kind of in flux with COVID, and a lot of the you know medical environment has changed over time, but it changed within a few years rapidly. And it feels like things are somewhat getting back to normal. But I still hear to this day, like, oh, 2 years ago, if you were here, would have been a lot different. But I think that's kind of forced me to become more creative and a better rep because I have to get through access barriers that I weren't presently there. I have to get a little bit more creative with how I approach my customers. Uh, I think everyone's a little bit cautious now, so it keeps me grounded and focused on strategy rather than just the daily messaging that a lot of reps I think get used to.
Sure.
And your program has really helped me kind of pinpoint where I need to strategize and maybe brainstorm ideas of how I can penetrate some of those barriers that are now present with the pandemic, with just in general, actually,
Right.
with myself. As I once stated, I think at least for you and I, you had kind of found that it was a confidence thing with myself,
Right.
and I have 10 times the confidence I had before, but I still think there's, room for growth. So,
Right. Right. And yeah, and you know what? And I actually want you to speak on that. There's people listening right now that they might be someone that's been wanting to get into the medical sales industry, and they heard about medical device, they heard about pharmaceutical, and they're not sure what it really means, where they really should go, what they should really be doing. Why would you say that it's necessary to have something like a service that can really get you into a position? What what would you say to someone that's listening right now?
um, a lot of the advice that's out there is really cookie cutter. It's going to be basic services. As I said, I've read a tons of books even before I got put onto your podcast, and I I just noticed that some of the advice was very generic, repetitive, and I think that's where you really separate from everyone else or every other program, at least that I had looked at the time. Um, Not to say there's no good books or anything like that,
Of course.
but
Yeah.
I would say that's the differentiating factor is that um, you and your team, were able to really fine tune exactly what it is that I needed, um, versus just like, oh, here's a general approach that works for everybody. And because it's such a rapid changing industry, the things that used to work for everybody don't necessarily work today. There are some things like networking, obviously, that's important. There are some principles that always hold true, but with things shifting to the internet and Zoom and virtual, it's really changed a lot. So I think you've seen that in your own career. I've seen it in mine,
Right.
and I think we're going to continue to see that. So
Yeah, and you're first of all, you nailed it. It's shifting fast, and because of COVID, everything that we all experienced, it's really it's been a catalyst for the direction we were all headed anyway. I talk about it all the time that we were headed towards this virtual world. Everybody was, not just in medical sales, but because of COVID, medical sales realized that hey, we got to catch up too, and now
yeah,
it's full throttle trying to make sense of it and hoping that it works. Um, one thing I want to know, and again, share it with the audience. You see value in getting services as you progress through your career. There are people out there right now that are in the field. They're listening to this in their cars as we speak. What would you say to them about why it's helpful to have a resource outside of your organization that can give you an added education to how you can perform better in the field and be and move further along in your career in the medical sales world?
to me, that's a really, really easy question, actually. It
Yeah.
kind of goes back to if you want to keep continuing getting the results that you're getting, then continue doing exactly what you've been doing. And if you want to change those results, you need to change that up. And um, I think more than anything, Samuel, you and your team, you guys have such a wide, like 10,000-foot view of everything because you see the medical sales industry as a whole, whereas I'm only able to see what's my narrow sector or this narrow sector of my company
Right.
and the way that they provide training. And I even learned from people from other companies, and it's true because everyone has a different style, and I think the moment that you commit yourself to continually learn and grow, that's the moment when you're going to start to see things that you wouldn't ever have imagined a few years ago even. So
Yeah, that's awesome.
and I'm seeing it already. I'm seeing things happen. I could already imagine myself promoting in a year or two, and I was just trying to get the job before. So it was
Complete.
a
You
whole
completely
different battle.
right,
Yeah,
right.
exactly. But that takes growth. And I think there are some people that maybe have that continual dedication and they're willing to learn on their own, but it's hard to learn if you don't have that feedback from others. That's what I would say.
Yeah, no, that's beautiful. That's 100% correct as well. It's hard to learn if you don't get that feedback from others. One thing I want to also get from you, Eric, is I want you to speak to those people that haven't made the move yet into medical sales and they're just thinking about it or they're wanting to do it or they're trying to do it. What would you tell them to look out for after they get into the position? Not so much what they need to do to get the interview, but more so when they're actually in the role. What do they need to look out for?
Um, I think it just goes back to, and this is just the way I think. Um, it's not for everybody, but I would say just don't become complacent. Don't get comfortable with the way things are being done. As I've said, things are rapidly changing. The industry is changing itself. Individual companies are changing. They're doing a lot of restructuring right now with my company in particular, and I know a lot of other companies are too. Sometimes, especially in pharmaceutical sales or in the pharmaceutical industry, smaller companies get bought out by larger ones. So the moment you become complacent, I think you can kind of just get left in the dust. So just commit yourself and also commit yourself to the fact that things will change, but you can adapt to it. And that's exactly what I've been doing with you. in a one-on-one basis. And I know you also have like a whole team behind you, that you can get workshops and really fine tune exactly what it is that you need to work on, because everyone is going to adapt differently to change. Some people freak out by it. Some people, they run away from it. Some people attack it head on. But I think it's really good to see those kind of flaws in yourself, and not necessarily flaws, but those things that you need to work on to get to the next level. Because as I said, it's not only competitive, but it's rapidly changing. And that's not to scare anybody off. That's more just to say, okay, well, prepare yourself for what you're going to go through. It can be stressful, but it's very rewarding at the same time. At the end of the day, you're helping out patients, and I don't see how there can be many jobs aside from being a doctor itself, or there's a few other jobs I'm sure that are more purpose focused and kind of patient centric, where you're actually the impact can be seen literally a few weeks out from when you were there with those doctors talking to them, and you're helping people. And that's, at the end of the day, what gets you through. The change part doesn't matter. It's the patient, and you got to stay focused on your why and your purpose. And I think that's why a lot of people stay in it.
Got it. And that actually segues right into my next question. And you kind of already answered it, but I was gonna ask you, why shouldn't someone get into pharmaceutical sales?
If you're getting into it for the money, that's obviously a bad reason. Um, it's something there. I think there are easier jobs to pursue if you're gonna just go in it for the money itself. If you are getting into it for any other reason other than to challenge yourself, and also to kind of fulfill that calling that I was talking about, at the end of the day, you're helping out that patient. I think the doctors that you call on will really see through the ones that are there to help the patients, and the ones that are there just to sell. And when they pick that up on you, the one that makes the sell or the sale, believe it or not, is the one that is there for the patient. I mean, it makes sense, but you would think it's those hard closers, and nope, that is not how it works in the medical sales field. I mean, you're talking to highly educated people who, I would say, for the most part, are in it for the patient as well. So, and they will see through that. So that's what my advice would be. If you are considering anything, if you're in sales and you think, this is kind of the pinnacle of sales and makes the best money, there are those that I think can do well if they're really competitive. But like I said, at the end of the day, it's got to be about that focus, because that's what's going to get you through.
I love it.
The money will come and go. You'll make, it'll just be a byproduct of you focusing on that purpose, and just fine tuning your weaknesses. Like I said, it's a lot to know. You got to know sales, you got to know the disease states, you got to know about the patients, you got to know about the industry, you got to know about insurance plans. I mean, you got to know a lot of stuff. So but yeah, the more you work on it, the doctors will see that, your customers will see that, and at the end of the day, the patients will benefit the most from that. So
I like it. I got one more question for you, Eric. And this is answer it the best you can, but I want to know from your end, because even though it feels like you've been doing this for a minute, you are relatively new. I mean, you got into the game of medical sales in 2021, and we are only in 2022, but you've already experienced so much. But for those listening that want to get into the industry, what should they, when it comes to what field they come from, right? Because we've helped people from all kinds of fields, teachers, customer
Yeah.
service people, salespeople, any people. What would you tell them? People that are hung up on, well, I don't have the science, or I don't have the sales. What would you say it's really about from your experience as far as getting into a role like yours?
Um, it's not about what you know when you get in. It's your dedication to being willing to learn those things. You may not know those things. You can get good at sales is a skill like anything else. It can be learned. Um, Medicine and learning the medical terminology and the disease states and becoming comfortable with it, it just takes practice. And I would say no matter where you are, I was kind of someone that had the science background, and maybe that's why I was a little bit more comfortable with the science and a little bit less comfortable with the sales side of things, even though I did have a sales background. Um, I would say no matter where you are, anything can be learned. It's a skill. And as long as it's a skill, somebody has been in their same place before and done it and excelled at it. So um, I sometimes think that the best advice comes from my teammates and my pod partners that are really from a different background, because I think people from a science background are going to look at it from a science way of looking at things. They're going to look at it from a microscope and dissect it and say, okay, what is the disease state and what are the symptoms? And they want to learn all the intricacies of things. But then there's some people that have, higher EQ. And then there's some people that like to teach. You were talking about teachers. So, but you also have to remember to be a student too, because doctors also love to teach. And I think you have to be just adaptable no matter what, and be willing to learn. If there's one skill that you gotta have, it's just have that willingness and that hunger and desire to learn. Because if you do, there's nothing that's gonna stop you. Absolutely nothing. I've been at the bottom, I've been at the top, and it took dedication, it took perseverance, but more than anything, it took me taking that chip off my shoulder and say, you know what? I don't know everything. I gotta stand back and assess what my weaknesses are and what I need to work on. And that took, that willingness to learn and that hunger. So
That's awesome. That's awesome, Eric. Eric, it's an amazing thing to watch you grow, man. The fact that you started where you started with us, and you're still here, and you're still doing things, and you're still making things happen, and you're literally evolving. As we very firmly believe in evolving your success, you are literally living that. So I'm so
yeah,
glad you're able to speak with us today.
yeah, me too, Samuel. And appreciate you having me on the show.
Definitely, definitely. And that was Eric Knotts. Cool guy, right? I love that story because Eric is truly an example of evolving your success. He wanted something, he found the resource, he made it happen. He wanted more, he found the resource again, and he's making it happen. I mean, and that's what it's all about, right? That's what this life's all about. Evolving your success to have a bigger impact on the people around you, whether it be the patients, whether it be your family, whether it be the people in your inner circle. You want to have an impact, and you want to do something good for them. And so you're consistently evolving. And you're reaping the rewards, they're reaping the rewards, everybody is winning. For anyone that's in the medical sales industry, I find it hard pressed to not see that they care about significantly impacting people. I mean, yes, you're impacting patients, you're impacting doctors, providers, you're impacting the staff, you're impacting administrators, you're impacting a lot of people in this industry. But at the end of it, at the core of it, you're impacting the patient. And it's hard to give it your all every day if you do not care about doing that. And most of the people that I've met care about doing that. And that's exciting. It's exciting to be a part of. It's exciting to help people become a part of it. It's exciting to help people thrive in it because we're all doing something that's so impactful. Your health is so important. And to be a part of that mission, it's a wonderful thing. So maybe you're listening to this episode and you're someone that wants to get into the industry. You've been thinking, I really want to make this happen. I'm not sure what to do. Or you've put your name out there and you've gotten a few interviews, but nothing's really happening. or you've got a number of interviews and you just can't get to an offer, then I want you to go to evolveyoursuccess.com and select Attain a Medical Sales Role and get in touch with someone that can help you and have a conversation and get to the bottom of what you need to do and how you can make that happen. And if you're someone out there that's in the field and you're saying, you know what, I want this year to be my most amazing year. I am ready to be the ultimate resource. I am ready to impact the patients that I somehow touch at the highest level. Then again, visit evolveyoursuccess.com, select Improve Sales Performance, and get in contact with someone from the team and have a conversation and learn what you can do to show up in a completely different, new, and impactful way. Why do we do this? Because we care. We care about the growth of individuals. We care about the growth of professionals. And we care about, of course, what's happening to the patient. So why not be a part of the thing that happens when good, talented people want to put their career, focus, and energy into doing better for patients. That's what we're all about. It's all about evolving your success. And that continues, right? You can get the job, and then you can succeed in the job, and then you can get into leadership, and then you can succeed within leadership, and then you can take things to entirely new heights. You're consistently evolving, and that's what we care about. So as always, thank you for listening to the Medical Sales Podcast. Make sure you tune in next week for another episode, and have yourself an amazing week. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.